Hello, my name is Kylie Legenstein, and I'm going to be presenting to you my research project on prenatal breastfeeding support and education and the impact it has on breastfeeding exclusivity and maternal confidence. Today, postpartum mothers are lacking the proper education and support that they need to have a successful start to their exclusive breastfeeding experience. Breastfeeding is a significant time for the postpartum mother and a newborn, yet only 1% of women are exclusively breastfeeding at 6 months postpartum. Yes, women receive breastfeeding education and support in the postpartum period, but is it more beneficial if they receive this education and support in the prenatal period instead? Breastfeeding education and support needs to start long before the baby is born for many good reasons. I chose this study because I work with all postpartum mothers and many of them want to breastfeed. Breastfeeding is a complex yet significant task, and I have found that almost all mothers need a lot of education on the topic. Problems that I have seen are unsuccessful feedings. They want to quit sooner rather than later. I and other nurses do not always have the time to assist them and teach them in the ways that they need. This leads to frustrated and discouraged mothers, and in the long run leads to unsuccessful and shortened breastfeeding periods. It also can lead to decreased patient satisfaction due to the inability of nurses to provide the support that they need. The purpose of this study was to determine that if women received proper breastfeeding support in the prenatal period versus learning about it after they've already had their baby, if this would improve breastfeeding exclusivity, longevity, and maternal confidence or self-efficacy. My PICO question is, in pregnant and postpartum mothers, does receiving proper antenatal breastfeeding support and education rather than after birth increase breastfeeding success, exclusivity, longevity, and maternal confidence and self-efficacy? Below, I have displayed the different parts of my PICO question. For my literature search of my 5 articles, I only used one search engine or database for the whole project. I was using the PA College Health Sciences Library Discovery tool, which was very user-friendly for me. Prior to searching for my articles, I was able to refine my search by selecting full online text, scholarly articles, peer review articles, journal article content type, and published within the last 5 years. The first article that I found was Patient Satisfaction with Postpartum Teaching Methods. For this article, I searched postpartum teaching satisfaction, and it was the first article out of 3,180 listed. This was immediately chosen because it applied to the foundation of the topic chosen. I was able to just look at postpartum education prior to researching the prenatal education aspect. For me, this search was easy. The second article that I found was The Effect of Antenatal Education on Breastfeeding Self-Efficacy, Primiparous Women in Turkey. For this article, I searched antenatal breastfeeding education, and I had to make it more narrow by searching antenatal breastfeeding education and self-efficacy. This was the first article on the list out of 1,101. This article was the core to the study I was trying to conduct. It gave me insight on how antenatal education leads to breastfeeding success and more, which was exactly what I was looking for. For me, this search was easy and it was very relevant to the study. The third article that I found was Antenatal Education to Increase Exclusive Breastfeeding, a randomized controlled trial. And to find this article, I searched antenatal breastfeeding education, and I had to make it more narrow to find the article, and I searched antenatal breastfeeding education and exclusivity. This article was the second one on the list out of 408 articles listed. It was chosen because it had different results compared to the other articles that I found, and I was able to spot differences in the results. For me, this search was also easy and very relevant to the study. The fourth article that I found was UK Women's Experiences of Breastfeeding and Additional Breastfeeding Support, a qualitative study of baby cafe services. For this article, I searched antenatal breastfeeding education, and I also had to make it more narrow by searching antenatal breastfeeding education and breastfeeding experience. This was a little harder for me to find, and it was the 16th article on the list out of 3,690. After reading other articles, I had found that this one had interesting findings on how prenatal breastfeeding education made mothers feel during their breastfeeding experiences. I was shocked to see that it explained how it gave women unrealistic information. It was very relevant to this study, and I thought it would be interesting to have this article because of the different results. The fifth article that I found was Incorporating Breastfeeding Education into Prenatal Care. I searched prenatal breastfeeding education for this article, and it turned out to be the sixth article on the list out of 5,786. I did have to read a few others before choosing this one, but I saw that it described why prenatal breastfeeding education increases breastfeeding initiation, exclusivity, and duration, which was exactly what I was looking for as a result to prenatal education, so I had to choose this article. This was a little harder for me to find, but obviously very relevant to the study. Many articles were reviewed and read prior to choosing those 5. I kept in mind what would make an interesting project, and I thought that those 5 would be great. Although they all focus on the same similar topic and some of them have the same results, others have different results. The different conclusions and studies allowed me to see how different women viewed different types of prenatal breastfeeding support. These articles can be contrasted, but more importantly were able to be compared, which made for an interesting search. A few involved first-hand experiences of breastfeeding women, which allowed me to know what I can do as a nurse to make a breastfeeding experience better, which was my sole purpose of wanting to conduct research like this. Comparisons. In the first article, they did a study that resulted in higher rates of breastfeeding success in breastfeeding mothers, which increased breastfeeding self-efficacy. The prenatal education classes that they used were about 60 to 90 minutes, and they were followed by a breastfeeding self-efficacy scale that assessed maternal confidence. The second article, which had a similar result, was by Pitts, Faulkner, and Spencer, 2015. They concluded that higher rates of breastfeeding exclusivity, plans for 6-month duration, and increased breastfeeding initiation all resulted from prenatal education modules at doctor's visits. After the participants read the education modules, they took a quiz afterwards to assess their knowledge. Another article that had similar results was Wagner and Washington, 2016. In their article, they stated that prenatal classes can increase the knowledge and skills of the parents prior to their birth experience, which can lead to their feelings of self-efficacy. There were other articles in my search that had completely different results. For example, Wong et al. 2014 found that 1-to-1 prenatal breastfeeding support sessions had no significant effect on the rates of exclusive and any breastfeeding at 6 weeks, 3 months, and 6 months postpartum. Another study had an interesting finding, and that was that antenatal preparation set unrealistic expectations of breastfeeding, which led to postpartum women feelings of failure and unpreparedness. They also found that prenatal breastfeeding education gave women feelings of pressure, guilt, and blame regarding their breastfeeding experiences, and mentioned conflicting advice and fluctuating levels of support. Although each article had their differences, they all focused on one main concept, which was prenatal breastfeeding support. Since they all focused on the variety of ways to receive that prenatal support, it was easy for me to compare the results of the studies. The results that were similar were simple to compare, and the conclusions that were different and opposite of what I expected were easy for me to pick out. With the differences in results, I could not come to one conclusion in my literature search. For example, I cannot say that all prenatal breastfeeding education and support leads to a better breastfeeding experience, because 3 articles that I found told me almost exactly opposite. Practice management and recommendation. Considering the similar results from those 2 articles, stating that their study methods resulted in an increased breastfeeding initiation, success, exclusivity, duration, and self-efficacy, I would recommend prenatal breastfeeding support to all pregnant women. The support methods that I would recommend as a result of these studies are 2 60 to 90-minute breastfeeding education support sessions a week in the prenatal period, as well as participation in the baby-friendly hospital-initiated breastfeeding modules initiated at doctor's office visits in the prenatal period. I also found that I could make a personal change and recommendation to my practice. I work in postpartum care, so implementing a change in a woman's prenatal care is not possible for me, although there is a change I'm going to make to my care as a result of this research study. Implementation of breastfeeding knowledge assessment prior to breastfeeding education in the postpartum setting. If I do this, this will allow me to assess how much a mother does or does not know about breastfeeding, and I can also assess if her expectations of breastfeeding are real or not. I could also implement a breastfeeding self-efficacy scale to assess maternal confidence in breastfeeding. In addition to this giving me an understanding of where a knowledge deficit is, I can also assess maternal confidence in breastfeeding and know where to support this mother emotionally. According to Hinnock 2016, comprehension and promotion of breastfeeding self-efficacy are necessary for nurses who work with mothers and families to demonstrate progress toward meeting public health goals for breastfeeding. According to this article, in 2016, a mother's breastfeeding self-efficacy levels and problems related to breastfeeding in the early postpartum period can be detected by health professionals by using a breastfeeding self-efficacy scale short form. There are some barriers to me assessing education prior to giving education, as well as barriers to the self-efficacy scales. The first one is that not all nurses will want to participate, and not all of them will assess breastfeeding education prior to teaching. Another barrier is that mothers will probably lack the desire to complete a self-efficacy quiz postpartum due to the fact that they had just had a newborn baby, and the last thing on their list is wanting to complete a quiz. In conclusion, clearly there are benefits to prenatal breastfeeding education and support that result in breastfeeding exclusivity, initiation, success, confidence, and self-efficacy. Not all education can be done in the postpartum period, so getting that support and education prior to having your baby can help better breastfeeding experiences. Some takeaways of this study are to always assess a patient's education and knowledge of breastfeeding. Always assess breastfeeding expectations to give you a better understanding of where that mother's knowledge is at. Also, always assess confidence and comfort level of breastfeeding so you can help support that mother emotionally.